Good morning, everyone. We'll give everybody a few minutes to hop on to the webinar. Welcome. Thank you for joining us today. Currently, we have everyone muted and your video is off to guarantee a better user experience for everyone on the webinar. Please put your questions into the Q&A box and we'll do our best to answer as many as we can. If we don't get to your question, please send it to ce@advocis.ca and we will answer by email. We're really excited to have Kren Henderson and Margaret Egan with us today. As the result of a challenging 14-year dementia care experience, Kren Henderson founded the Long-Term Care Planning Network, Canada's leading on and offline resource center for aging and long-term care. Her seminar series, websites, newsletters, TV, video series, and long-term care planner are internationally recognized as key aging and long-term care educational and resource tools. Margaret is founder and managing director of brand strategy consultancy, Sinclair Barnes Limited. She works globally with clients across many sectors to develop and implement brand strategies and marketing plans. We have a jam-packed schedule, so let's get started.
I would like to thank Christine and her team for welcoming both Margaret and I to present this event around client conversations. And my topic today is long-term care client conversations, what your clients are facing today. Before I begin, however, I'd like to say a few words about my dad. Now, some of you who have heard me speak before know a little bit about my story, but very quickly, my father died in long-term care of the flu over 20 years ago. He suffered from vascular dementia and Alzheimer's. He suffered from stroke disease and spinal arthritis, put him in a wheelchair for the last years of his life. My dad stayed alive until the age of 94, I believe, to show his daughter what it was like to age in Canada. And back then it wasn't great. And now 21 years later, we know it still isn't great. And as a result of COVID, in many cases, it is catastrophic. Now, we all, as a result of COVID, have probably changed our business model pretty much on the fly. And however, as financial advisors, regardless of how you are working these days from home or hybrid or whatever, these are the kinds of things that your clients need to know. They want to know, how does the long-term healthcare system work? Where can I live safely and happily? How can I fund this? Does the government pay? Do I pay? And if I pay, how much do I have to pay? How and when do I start planning? And finally, where do I go for help and information? So let's begin to help your clients with the long-term healthcare system. Now, what I will say right off the bat is that long-term care is misunderstood, unfortunately, by both advisors and clients, which makes your job that much more challenging when you want to talk to your clients about long-term care planning. And what long-term care is, it is the provision of custodial as opposed to medical services and accommodation for those who are ill, disabled, or who are cognitively impaired with something like Alzheimer's disease. Long-term care is not cure. We can't cure Alzheimer's or ALS or diabetes or arthritis, but what long-term care should be able to do is allow people to live out their lives with dignity and safety. Most long-term care, in fact, over 80%, takes place in people's homes, provided by families, also in retirement homes and long-term care homes. Long-term care can go on for years, which is something a lot of people don't understand. And as you will see as we go through this presentation, there is little government support. And finally, a lot of Canadians operate under misconceptions or denial regarding their need for long-term care. In other words, their common sense kind of goes by the boards. Let's move on now to the long-term care planning continuum. And this is the path that one takes through the long-term healthcare system as one needs more care and support. So let's start with home and community care. This is what seniors want. They want to age in their own home. They want to age in place because they're independent. They are in a familiar environment, and they are around family. Governments, however, do not provide enough subsidized home care to allow seniors to remain in their homes the way they would like to do. So if people have to private pay, which most do, the hourly rate across Canada ranges anywhere from $28 to $80 an hour, depending on the service that an individual needs. And if we're looking at annual costs, home care can range anywhere from $35,000 a year for about 4 hours a day, anywhere up to over $100,000. And how did I arrive at this figure? Well, a neighbor of mine was dying of cancer 5 years ago. He wanted to remain in his own home. So his family hired 2 private caregivers, 12-hour shifts, 7 days a week, and the cost was $10,000 a month 5 years ago. So these numbers absolutely overwhelm most people because Canadians simply don't get it. Next on the continuum is retirement or assisted living. Now, these homes are privately owned and run. They provide a secure way of living, lots of socialization, care, and support. However, when people move in, they are pretty much independent. And so there is minimal care provided in their monthly rent. And if they do need care, a resident can purchase a care package. In Ontario, retirement or assisted living homes provide no subsidies, although some other provinces do for assisted living. And again, rates across Canada for retirement home living can range anywhere from $2,000 to over $12,000 a month, depending on the level of accommodation chosen and if a care package is required. Next on the continuum is nursing or long-term care or memory care. Now, these homes may be owned by a for-profit organization, a not-for-profit, a charity, a city, or so on. However, regardless of ownership, these homes are all legislated by the provinces. They provide 24/7 care for people who need chronic care and supervision. The government, in this case, pays for food and care, and the residents pay for accommodation, and these rates are set by the provinces. In 2021, the rates across Canada for a bed in a nursing home range from $0 in the north to about $3,500 a month in British Columbia. And finally, on the continuum is palliative or end-of-life care. Now, this care is integrated and patient-centered and is usually headed up by a palliative care specialist with a trained team. And their goal is to control pain and symptom problems. They also, however, provide support for the family during the illness of the individual and after the death of the individual. Now, this kind of care can take place at home, in a hospital, or in a care home. However, in Canada, only about 15% of Canadians receive truly integrated palliative care. And the last thing that I want to say about the care continuum is that Canadians and their advisors continue to be confused between the difference between a retirement home and a nursing home. Essentially, retirement homes are privately owned and run. There are no subsidies, and nursing homes are legislated by the provinces, and they set all the parameters for care. In addition, however, to the complexities of this care system, which, by the way, is different in every province, Canadians are facing a number of other problems. The first is what we call unmet home care needs. In other words, right now in Canada, there are over 500,000 Canadians who can't stay in their own homes and age in their own homes because their province is not providing enough home care. And the other reality is that right now in Canada, there are over 50,000 Canadians waiting for a bed in a care home because they need to be there. They are very ill or they suffer from a cognitive impairment. And these numbers have existed before COVID. So we can't talk about long-term care without talking about the impact of COVID-19. But before I do that, what I'd like to tell you is that I did a little bit of research on this. And what I found was that in the last 20 years, over 150 reports have been written on the scandalous condition of long-term care in this country. And these reports talked about the problems, the abuses, the shortcomings, the rage that families felt about what was going on in long-term care. They all made recommendations and almost nothing has happened. So how did things get so bad and stay that way? Well, we Canadians, we citizens have ignored long-term care. We have put our elders in these facilities and essentially crossed our fingers that they were getting good care. There's been a huge lack of provincial and federal government oversight and accountability from the owners and operators of these homes. Many of the for-profit homes were built in the 1970s, and quite frankly, they're crumbling. And that was one of the reasons that COVID ripped through for-profit homes, because they simply were not designed to protect people in an epidemic. There's never been consistent funding from the federal government or provincial governments for long-term care. We all know about the huge shortage of trained staff, and these poor people, these what we call personal support workers mainly, have been underpaid and mistreated for years. There was never any concentration on personal protective equipment, infection training, or facility infections, even when homes were hit badly with the flu in the year that my father died. Long-term care homes, residents are really ignored in this country. They're very ill, they're very vulnerable, and they don't have a voice. And finally, we have seen how badly ageism has risen its ugly head. Ageism is prejudice or discrimination on the grounds of a person's age. And what COVID has shown us is how badly we have treated our older people in this country. And here is probably the worst example of ageism and abuse that one can imagine. We all know that the military was called into both Ontario and Quebec March and April of 2020 because things were out of control in many long-term care homes. Now, what you see in front of you is one page from a report on one facility in Pickering, Ontario, and it was provided by Operation Laser. The facility is Orchard Villa, and what I'm going to do is just point out a couple of things for you. This is despicable and very difficult to read, but what was shown here is that there were cockroaches and flies present in this care home. Rotten food was everywhere. There was inappropriate use of protective equipment. Patients were left soiled in their diapers rather than being taken to the toilet. And nurses and PSWs ended up feeding people lying down, which resulted in choking and in fact resulted in the deaths of some of these residents. Staff put food and important belongings outside of residents' reach. Hip fractures were not addressed properly. And we could go on and on and on. And I'd like to refer to my notes and just read you a few things that have been written about this situation. One professional calls the high number of deaths in Canada that totaled about 14,000. She called this eldercide. And she wrote, the problem that is that we don't value old age. COVID made ageism far worse as we saw people in nursing homes dying because they didn't matter enough. Many people thought that they died because of incompetence. That was true, but ageism explained it better. We've been hit over the head with eldercide and other kinds of growing ageism. And if we don't pay attention now, we'll never pay attention. And finally, a US geriatrician said, we put loved ones in nursing homes, underfund these homes as a society, and hope never to have to use one ourselves. And that brings us to the tricky issue of for-profit versus not-for-profit. The home I just mentioned was a for-profit home. And so a lot of people have wanted to know, what is the difference between a for-profit nursing home and a not-for-profit nursing home? And this information was never really known by Canadians before COVID hit. So here are the basics. A for-profit home is a home that is usually owned by a chain, in this case, Chartwell, Sienna, Extendicare, or Revera. And in the case of the home I mentioned, Southbridge, there are lower staffing levels in for-profit homes. The staff get paid less. There's more temporary staff. The homes are older. The residents get reduced care. There were definitely more COVID deaths in for-profit homes. And I will tell you that Southridge Homes, the owner of the home that we just reviewed, made a profit of $28.6 million in 2019, most of which went to shareholders, did not go to the home. Here are what not-for-profit homes look like. They are owned by cities, municipalities, charities, and religious groups. They have a higher staffing ratio. Any money that is made in not-for-profit homes gets put back into the home, and they have greater accountability because they are not-for-profit operations. Here is another example of ageism. And this is really what we call systemic ageism against the immigrant women who really are the backbone of long-term care in this country. In this photograph that you see that was taken at a Chartwell long-term care home, the staff do not have appropriate masks, they do not have appropriate eyewear, and they are wearing garbage bags to try and protect themselves against COVID. So what has been the fallout of COVID so far? Residents are still dying. In fact, I just read that several more have died this week. Residents are still receiving less medical and hospital care. Staff are leaving long-term care homes in droves. They are moving to hospitals and other opportunities because they're being paid more and they are being treated with more respect. We still are seeing huge issues and increases in elder abuse. Many residents continue to live out their lives with pain and loss. Many families will be forever traumatized by what they went through. And as a result, there's a complete loss of trust in long-term care in this country, and class action lawsuits have been launched across the country. And finally, many long-term care residents are experiencing what we call confinement syndrome. And what this is, confinement syndrome results because a frail individual has been isolated for months, as thousands were in care starting in March 2020. They become more frail, they don't eat, essentially they lose hope. And many of these people who suffered confinement syndrome ended up dying. We call it a disease of despair. These residents died in despair. So, as a result of all this information that is absolutely public and has been in the media for 18 months, your clients are asking themselves, do I really want to go into a nursing home? Or would I rather stay in my own home with home supports? And if I can't do that, would I rather live in a home with fewer people where I felt like a real human being? But what we have found is that too few people have done the research to prepare to age in their own home as opposed to moving into a nursing home. And how do we know that? Well, back in June of 2020, a national survey was taken about Canadians' attitudes regarding long-term care. And the vast majority of people interviewed said they would do anything to stay out of a nursing home. But we also learned that 30% do not feel prepared to live on their own, and almost 80% would not know what to do if they fell, if they were living on their own. So in other words, they haven't done the work to ensure that they are safe living on their own in their own homes. But that has not stopped the interest in the desire to age in place as the result of COVID-19. And the desire is there because it's a healthy, safe environment. It's less expensive than a retirement home. It gives people their independence, their familiar environment. They can maintain the way that they have lived for years, and hopefully they're close to their family and community. However, aging in place, as appealing as it may be, doesn't always make sense. Why? Well, because there may be too few people around to help. If nobody actually lives in the home with the senior, the home may require extensive, expensive adaptations. It may not be close to their physician or their pharmacy. There may not be room for an overnight caregiver or equipment such as a hospital bed. And many older people become very uncomfortable having paid strangers or caregivers in their home. As a result, if they remain in their own home, they can feel lonely and isolated. And if they don't drive, there may be few alternative transportations available to them. And finally, aging in place doesn't make sense if the health problems really require more care. The other issue about aging in place is the challenge of living alone. Living alone can result in tremendous social isolation. It's easy for disease to go unnoticed if a person living alone has sight or hearing problems. Physical limitations, fatigue, pain, and memory problems can make living difficult, as can transportation fears. But the biggest concern is having no one right there in an emergency to respond to help. And this infographic truly illustrates the dangers of senior loneliness and isolation. A lot of research has been done on this because so many seniors are ending up on their own. So it is an extremely critical issue when it comes to decisions about remaining in your own home. Let's move on to funding options. So let's look at what governments do and do not subsidize. They subsidize what we call medically necessary services as defined in the Canada Health Act, which means physician, hospital, and diagnostic services. A limited number of home care hours, as we have seen earlier. They pay for food and care, as we have seen. They will subsidize some senior services, such as physio, and each province has an assistive devices program, which means that they will subsidize the cost of a walker or a wheelchair or other equipment. What governments do not subsidize is retirement homes, most prescription drugs. They only subsidize those that are on what we call a provincial formulary. They will subsidize dentistry if it is performed in a hospital, and very limited optometry. And in fact, in the province of Ontario, on September the 1st, because of a years-long disagreement between the provincial government and optometrists are now working to rule those over 65 or those under 19 will no longer receive OHIP-covered optometry services in this province. So here are the funding options that are available to your clients. Obviously, up here we start with the government subsidies and pensions, OAS, CPP, GIS, which we know don't go very far. Reverse mortgages are becoming of greater interest to people. They can work in some cases, but the services of a lawyer are highly recommended if a client is interested in reverse mortgages. Obviously, personal investments. People are looking at downsizing. If they have a house that's worth, say, $1 million, they think that they would like to downsize that. But the problem is, where do they move to? If a condo is going to cost them $700,000 or $800,000, what have they gained? If you're lucky enough to have a corporate pension, that may be a funding option for you. And finally, long-term care insurance. I've personally have seen an uptick in long-term care insurance as a result of COVID-19. But it's too bad that more people don't look at long-term care insurance as a retirement planning tool instead of a hedge against an unexpected disaster. Let's move on now to the care planning conversations. So I've provided you with a lot of information that you can share with your clients to help them live with independence, dignity, and control. But the big question is, how do you get them to talk about the things that they need to talk about as they age? As we retire, it's easy to talk about trips and what we want to give our grandchildren or our children. It is much more difficult to plan for our own aging and end of life. So what I'm going to do is introduce you to some tools which I hope will help you. Before we examine these tools, however, let's look at why we should have these care planning conversations. First of all, it makes sure that your clients have their needs fully taken care of to help them avoid dependency. And we'll talk a little bit more about dependency later on. It ensures that they have completed and or updated their wills, their powers of attorney, and perhaps a letter of direction. It integrates long-term care funding into their financial and retirement plan and gives them time to learn about services, accommodations, and costs. Finally, it allows them to make important decisions while they are still physically and cognitively able. I was power of attorney for my dad, and at the outset, I had power of attorney for property. I did not have power of attorney for personal care. When I understood this, I made a mad scramble to get the document done and to get my dad to sign it. 2 weeks later, he was unable to sign his name because of his dementia. That's how fast things can change with an elderly person. So let's look at our first conversation starter. Longevity is an issue that we all face. None of us want to run out of money as we age, but many of us are afraid that we're going to do so. So the first tool that we have is around longevity. Now, I know that as advisors, you have access to software that can run scenarios based on client longevity. But this tool is different, and you may have heard of it before because I have talked about it. It's called livingto100.com. And here's how the conversation may go. John, both your parents died in care. We know that. And as we have discussed your retirement, we've done a lot of planning, but we have not moved into the final phase, which is the care that you might require as you age. And how I'd like to start doing that is asking you to go to this wonderful website. It's called livingto100.com. And when you go there, you will be asked questions about your personal life, your lifestyle, your nutrition, your medical situation, and your family. When you answer these questions, the algorithm will provide you with two things. It will provide you with the age to which it expects you to live, and it will provide you with a report. And what I'd like you to do is to bring that report to me, and we will have a meeting. And why is this so important? It's important because A, we have a more targeted age to work to. B, we both have a lot of information about you, which we can add to your KYC, which I now call a senior KYC, which I've developed for some clients. And finally, most importantly for you, the advisor, it's had John involve himself in his own long-term care planning by going to livingto100.com. Our second tool involves a series of questions, which I think, quite honestly, are more suited to women, because these are the things that we think about more often, because in many cases, we have been caregivers ourselves. The first is, how likely am I to need long-term care? Well, that depends on age, present health, family health history, marriage status, lifestyle, and whether or not you live alone. The next question, and this is the question that keeps people up at night: who will take care of me? Will it be a spouse? Will it be a child? But what if they can't? And when should I start thinking about planning? Well, before something happens, before a fall, before a stroke, or before the diagnosis of a long-term care illness. How much money will I need? Well, that will depend on the cost of care in your area, your present and future health, and what your care goals are. Where do you want to live? And how much are you prepared to spend? And how will I pay for that care? Well, that would be a discussion between the client and the advisor. And finally, how should I organize my information? This really is an issue around risk management. Many of us have information on our finances over here and on our family over there. And by organizing all of this information in one place for easy access, we can avoid decisions made on inaccurate or unavailable information. Now, here is our third tool, and this tool is courtesy of MIT Age Lab in the US. The first is, who will change my light bulbs? And your client's probably wondering, why on earth would you ask me that question as I'm getting older? And the answer is because, John, you need to understand who is going to help you stay in your home, who's going to maintain it and keep it safe and keep it up to date. The second question, how will I get an ice cream cone? Well, Mary, this revolves around adequate transportation. As you age, will you have transportation to get where you want to go and when you want to go there? And the final question, Mary, who will I have lunch with? What does this mean? It means, do you have a social network? We've talked about social isolation, and this is particularly important for women because many of us end up living on our own, and it's really important that we have an appropriate network to support us as we age. Now, if that tool doesn't work, we have a fourth tool, which means the creation of a sample care funding plan. And this shows your clients that you really truly can create a financial plan for aging. And what does it involve? Well, first of all, it involves the assessment of the client. And a lot of this information you should know through your KYC or through the conversations that you have had over the years. Age, marital status, family history. Available family support is very important to know, and living and care wishes. The next thing that you need to talk about is the care continuum. And remember that chart, that colorful chart beginning with home care and ending with palliative care. You need to talk to your client about what he or she wishes as he or she ages, because it's going to influence where they live and what the costs are going to be. The third step, here's an example. Let's say that your client wants to start out at home. So the first year would be $44,000 a year. Second year with increased home care, $66,000 with a total of $110,000. However, your client becomes more frail and needs to move to assisted living, $80,000 a year for $160,000. And finally, your client needs increased care and at the moment is living in Ontario. So 1 year in a private room in a long-term care home is $36,000 for a total of $306,000 in today's dollars. The next step is to talk to your client about dedicating appropriate funds. And finally, if long-term care insurance is being considered, estimate how much to fill if there's any funding gap. So this tool would be very, very, I think, appealing to perhaps the male clients in your client base. Now, what I'd like to do now is move on to 3 brief case studies or conversations as more examples for you. The first is Carol. Now, she is a 57-year-old woman, single woman, who came to me, which is very unusual for such a young woman to want a long-term care plan. She owns her own condo, has a good pension, savings, but she has some serious health issues. And her main concerns were outliving her money and aging alone. So in my care plan for her, I helped her understand the long-term care insurance quote she had received from her advisor. I helped her with her housing decisions. In fact, I gave her the names of assisted living facilities in areas that she was interested in. I helped her understand the importance of growing her personal and support network to help ensure that she doesn't age alone. And finally, I pushed her to update her will and complete her powers of attorney, which were not completed, and then to communicate them to those who would be acting as her power of attorney. The next case is Mr. and Mrs. A. Time running out for this client, this couple. They're married, age 72. They have a single daughter with a young child. And the problem is that Mr. A's health is rapidly deteriorating. His wife doesn't know what to do. She doesn't understand the healthcare system or how to get help. And her daughter is trying her best, but she can't be of much help. My role in this scenario is I was called in as a coach to the advisors. So we held a webinar and I educated them on the healthcare system. I provided them with costs of care and support. And I even provided them with the names of local service providers in their client's area. And in this way, they were then able to provide tremendous added value to these clients. The last is David. David is facing a very serious crisis with Alzheimer's. And because of your aging client base, you're going to be facing the same problems. Both his wife and he are 75. They own their own home. Their adult children have left. The wife has been diagnosed with Alzheimer's. She needs help, and David, quite frankly, doesn't know how to provide it. I was called in again by the advisor to help create a care plan, to help them assess their home, to keep it safe for his wife. I helped them establish a relationship with the government agency that provides support. It's called the Local Health Integration Network. And as I'm speaking right now, it's really no longer the LIN that you may be familiar with. It's now the HCCSS, or the Home and Community Care Support Service of Ontario. And finally, I was able to suggest ways to enable David to look after his own health. So as a result, they were very grateful to me, but they were also very grateful to their financial advisor for this support. And I'd like to talk now, as I near the end of my presentation, on why it is so critical for your clients to plan now. The first is Canada's aging population, which is no surprise to anybody. By 2030, 1 in 4 of us will be over 65. And once we hit that age, 70% of us will need some form of care. The big problem is the federal government's funding does not match the needs of an aging population, because as we live longer, we live with more chronic illnesses, especially women. The second reason to plan right now is the rising risk of Alzheimer's disease and related dementias. Again, you're probably seeing this in your practice. Right now, at least 500,000 Canadians are suffering from some form of dementia. 65% of those are women. We are diagnosing 1 case every 9 minutes, and it's the most significant disability among those over 65. But unfortunately, it can strike much earlier in the 30s, 40s, and 50s, and we call that early onset dementia. There is no known cause or cure, in spite of the fact that billions of dollars are being spent on trying to figure out what causes Alzheimer's. What we can do now and what we must do is reduce our risk and do the best we can to prevent it. And in order to help you and your clients do this, I'm providing from the magazine The Lancet 12 modifiable risk factors for dementia. Very quickly, number 1 is the more education you have, the better. Number 2, control blood pressure. Number 3, have hearing check, because research is showing there is a strong correlation between reduced hearing and onset of dementia. Number 4, don't smoke. Number 5, watch your weight. Number 6, if you are feeling depressed, have it treated. Number 7, avoid social isolation as we have learned. Number 8, get off the couch and be active. Walk, if nothing else. Number 9, if you have diabetes, control it well. Number 10, drink responsibly. Number 11, watch head injuries. If your family bikes or skis, make sure they wear helmets. And number 12, this is one of the newest risk factors. They're finding that those who live in very polluted areas near major highways have an increased risk of coming down with some form of dementia. The third reason we should plan is the unacceptable state of long-term care. Will long-term care be integrated into the Canada Health Act or the continuum of care? And right now, it is not formally a part of the continuum or the Canada Health Act. It's actually an orphan. What about national standards? There's no national standards in this country for long-term care. Are the new beds being built what we want? Are they being built in huge impersonal buildings? And are they going to be publicly owned or privately owned? I think the government knows what we want. In Ontario, they plan to hire 27 new staff over 4 years. I don't know, quite frankly, where they're going to find 27,000 people. And will the standard of care reach 4 hours a day? We, as a country, are at the bottom of the list when it comes to the amount of care that we provide our residents. Will there be funding for home care? Will the regulations be enforced? There's tons of regulations, but they're not enforced. And finally, is there really any political will? The problem has been there has been no political will for over 20 years to change long-term care. The fourth reason that we need to plan now is obviously COVID-19 and successive viruses. Quite frankly, Canadians have been stunned by the indiscriminate power of this virus. No one ever thought that if they got a virus, that they would go to the hospital and never come out. And nobody ever thinks that they would be put on a ventilator, even if they know what it is. So now is the time for your clients to plan for their advanced care. Tell others what they want at the end of life, whether they want everything, all the care possible, or whether they want to avoid things like ventilators. And finally, for your information, since 1918, there has been 14 pandemics, and there will be more. The last reason that we need to plan now is MAID, Medical Assistance in Dying, which was federal legislation passed in 2016. And what MAID is, very quickly, is a procedure to end the life of an adult safely at their request. Since MAID began in 2016, 21,500 people have died through MAID, although many more have requested it but haven't qualified. The average age for MAID is 73, which quite frankly I find young, and the oldest is 104. And the reason people ask for MAID, the main reasons anyway, are cancer, neurological conditions such as ALS, and cardiovascular disease. Now, this is a slide that I put in because I've talked about two areas that affect older adults, and those are abuse and cognitive impairment such as Alzheimer's. And in July, the Canadian securities regulators published the final amendments to enhance protection of older and vulnerable clients. All registrants, advisors, will be required to obtain the name of a trusted contact person, and advisors will have the opportunity to place a temporary hold on financial transactions. Now, there are several websites here that you can go to refer to for more information about this very important legislation which has just come about. Here are my closing summary thoughts for you today. Why we don't care about long-term care, and we should. Because it's easier, we tell ourselves, I'm going to remain healthy, I'm going to live a long time, my family will look after me, they'll have you talk to them about it, the government will provide for me, well, we know that's not going to happen. I'll stay in my own home until I die. Well, maybe you will, maybe you won't. I don't know how much it costs. And quite frankly, I don't need to think about it just yet. And I have in front of me in my notes 2 pages of pretty amazing reasons that people don't plan for long-term care. Here are a couple of pretty funny ones. I'll move in with my oldest daughter. I raised my kids and it's time for them to take care of me. I have to talk to my children to see if they think this is a good idea. My father died suddenly of a heart attack, and my mother died only a week later in a nursing home. I won't need it because I'll probably go the same way. And finally, I'm not worried. When the time comes, I'll deal with it. And that, unfortunately, is what too many people in this country think. When the time comes, I'll deal with it. So I'm going to ask you finally what you think your client's most important asset is, and it's not what you think. If you say money, you are right. Money is extremely important because it gives people control, but independence is your client's most precious asset. To maintain it, in their 50s and 60s, they need to manage their legal directives so that they have a say in their care. In their 70s and 80s, they need to manage their home and downsize. How many of you have had to be involved in downsizing the home of a parent? I was with my dad, and it is a huge amount of challenging and emotional work. And finally, in the 90s and 100s, your clients need to stay connected, they need to stay involved, they need to have purpose and hope. When my dad used to come to the house or when I used to go to my dad's home to help him, he would always say to me, Karen, let me wash your car. And because my dad had such bad spinal arthritis, I would say, no, Dad, that's okay. But I ended up giving in to him. Why? Because he needed to help his daughter. He needed to have something to do. So here's your action plan. Educate yourself and your clients about long-term care, which is what you're doing right now. Discuss long-term care planning at annual client meetings. What some advisors have told me is that the minute a new client walks through the door, they are very clearly told that they will be talking about long-term care planning at every meeting, regardless of how old they are when they walk through that door, whether they're 45, 55, 65, or on. Use COVID, how it has changed everything and made long-term care so much more important to talk about. Create a funding plan for appropriate clients. And finally, build yourself a network so that you have people, quite frankly, like me, to call upon when a client calls you and says, my wife has Alzheimer's and I don't know what to do. You look like a hero because you are providing a solution for your client. Here's how the long-term care network can help you very quickly. We can help you with case studies, with advisor coaching, with family consulting. We can work on writing articles, doing PowerPoint presentations, webinars, of course, live events when we're allowed to do that. And finally, online tools. Do you remember that graphic of the care continuum, the 4 boxes starting with home and community care? That PDF with a lot of explanatory information will be available for purchase very shortly on my website. You can download it and use it with your clients to help explain the long-term care continuum to them. Here are your resources. Here are articles that I have either been interviewed for or I have acted as a resource for. They involve the pandemic, living on your own, and the high costs of retirement. This is extremely valuable information for you, your clients, and quite frankly, your families. Tremendous added value once again. Here are my resources, my website, my care planning conversation pamphlet, which I'll mention in a moment, a guide for Canadians. The critical illness and long-term care planner is a place where clients can place all their information about a person needing care, from a nickname to end-of-life wishes, and the 10-step long-term care planner, which essentially creates a long-term care blueprint when it is completed. And here is your last tool that you can use with your clients. I am delighted to be able to offer you a complimentary copy of It's Never Too Early to Start the Care Conversation, a guide for adult children and their parents. Thank you so much for taking the time to view this webinar. I hope you will find the tools I provided useful and that you will be able to choose one to suit each of your aging clients. Long-term care planning is a natural part of aging and should be a positive experience, as you will learn in the next session. It is a win-win for both you and your clients.
Hello, everyone. I'm delighted today to have been asked to present to the Advocis audience alongside Karen. My topic is, can client conversations be made easier? Now, Karen has just taken you through the long-term care situation as it exists today. I'm going to turn my lens to you as the financial advisor and take a look at one of the key challenges that you told us when we talked to you. Before I start, I just want to tell you how I fit into all of this. Karen, as you know, is an expert in long-term care. I am a brand and marketing strategist, so my clients hire me to help them create marketing and brand plans. Among the clients I have at the moment, both in Canada and the UK, are house builders, home builders, who are looking at a number of different segments of the population, one of which is seniors. How do seniors live in their home as they age? Where do they want to live? How do they want to live? And how does the home building industry meet that demand? One of the aspects of that was, how do seniors fund their senior years, and particularly when there are healthcare implications? Karen and I met up last year, and I suggested to her that maybe we team up by doing some work with one of the groups that are key players in all of this, and this is you, financial advisors. So what I'm going to take you through today is partly informed by what we learned in having conversations with you, and I will thread some of that through the presentation. Equally, it's informed by the wider work I do, and that includes things, again, very pertinent to today, such as aging in place. So let's get started. What we're going to go through is the challenge, as you've told us about, in terms of client conversations, why these conversations are currently not easy, how changing the context of client conversations will make your conversations easier to hold with your clients, and we'll finish up with some examples of literally how you can craft some conversations. So the challenge, what did you tell us? Well, we interviewed financial advisors across Canada, and number one question each time from you, bar none, was this: why is it so difficult to have client conversations about long-term care? Well, here's where you feel that you are on solid ground. The Canadian retirement dream, as I've put here, and as we are ending summer, I've put this lovely Canadian lake scene. This is the Canadian retirement dream. This is what Canadians look forward to. This is also the place where most of you told us you start integrating discussions about long-term care. It's within a larger discussion about retirement. And that makes total sense, obviously. One of the advantages of starting there is that by and large, when you talk about retirement with your clients, it's a generally positive context because people are looking forward to it. The other thing is that both you and your client roughly know the route map here. You roughly know the elements that are going to be taken into account to discuss retirement planning. Media covers this so extensively. People are really quite well informed. So it is something that is relatively easy, given all of that, for you to discuss with your client. All change when it comes to this, however, and this is not the Canadian retirement plan. This very sad gentleman in his long-term care home. This is something Canadians dread, and Karen has made that amply clear in what she has just presented to you. The context here is almost always negative. It's sometimes sad, it's sometimes desperate. And as a result, you find it very difficult to talk to people about this, even if you do all the things that Karen has suggested and that I know a number of you do, which is to mention long-term care planning in each annual review that you have. But it's a very difficult thing to discuss with your clients. So what we're going to look at is how can these client conversations talking about long-term care be made easier? And by that, I mean easier for your client, so more relatable to their lives, more motivating so that they actually do something about it, and less emotional, because very often they are considerably emotional. And also easier for you as a financial advisor. So easier for you to incorporate into your discussions about retirement planning, and also more successful in clients to actually take action, not just discuss, but take action. And by that, we mean to make a plan. And just to say, and I know Karen shares this view, neither Karen nor myself are financial advisors ourselves. So we are not pushing any instrument, any particular financial solution. That is your area of expertise. But what we are very much advocating is that everybody needs a plan going forward. So before we look at how we can make client conversations easier, let's look at why currently they are not easy. Again, from what you told us, you've said that too many of your clients will say this: well, you know, I don't need long-term care. I don't need to worry about that. And Karen has itemized a number of reasons that people give as to why they don't and why they don't want to engage with this. And roughly these fall into two different camps, if you like, in terms of what people really mean. You know, what's behind this? Either they don't know enough to make a decision, so let's leave it to one side, or I don't see myself in long-term care. And generally the reasons that clients don't want to engage is one or both of these reasons. If we look at the first one, I don't know enough to make a decision. What's happening here? If you think about the amount of information that people want and where that money is going to come from, there is a very great fear of getting it wrong. You know, I've built up a retirement fund. Do I want to put my money into something that maybe I will never use? Do I want to take the chance that I'm putting it into the wrong thing and it won't actually pay out when I actually need it? The fear of getting it wrong actually contributes to putting off this decision, and as a result, reducing options. And that's even when people think it is important. And I think one thing that we can say about people, and particularly after the trauma of COVID and the long-term nursing care scandals, people know this is an important thing to look at, but basically they don't know what to do. This is an opportunity for you as financial advisors, clearly. But one thing to say here is that if people are not up to talking about this, then no amount of information, client education, webinars, whatever, is going to move the needle, is going to make them take action. That is because of the next consumer typology, essentially. I just don't see myself in long-term care. Now, I said that I'm a marketer, and one of the phrases we use all the time in marketing is for me. Is something for me or is it not for me? Basically, this talks to how relevant something is for you. And if your clients don't see something, and in this case, long-term care, as for me, for them, relative to them, they're unlikely to take any action. And this negatively impacts their interest or inclination to discuss. And this, I think, from my point of view, from looking at it with my lens on the issue of client conversations and long-term care, this is a better and this is a bigger, and almost a more intractable issue than lack of information. So if people don't see themselves in long-term care, if they don't see it as for me, where do they see themselves? And for this, I have gone back to a chart that Karen has already shown you, which is the long-term care continuum. And I don't need all the bits that Karen used, so I'm just going to build up that chart because what I want to concentrate on are the bottom two lines. As Karen described, this is a system that is a custodial system. And quite honestly, custodial is not something people are keen to engage with. Why? Because custodial means it's not my choice. Somebody else is making the choices. Somebody else is making the decisions. And as Karen quite rightly said, people want their independence. They don't want to be in a system where they have lost control. Equally, when you look at the definition of who is in long-term care, people with chronic illnesses, people with disabilities, people with a cognitive impairment. Well, given that sometimes you are trying to encourage people quite a lot younger than maybe 65 to start thinking ahead to their long-term care, they don't see themselves in any of these boxes. And even if they're not naive, however, even if they think, you know, there's a chance I might end up in this kind of situation, they will do, and Karen made mention of this, they will do everything they can to sort that outside this long-term care continuum. Now, it's not just me, and it's not just off the top of my head that I'm saying this. There have been endless polls, as you will well have seen over the past year, 18 months, looking at how Canadians view long-term care. And basically, what it's telling us is that the majority of Canadians do not want to be in this market, if you think of long-term care as a market. I just want to highlight two polls of the many that have been done. The first one is a poll done jointly by the National Institute of Aging and the Canadian Medical Association. They did this poll last year, reported it in December 2020. They asked Canadians, and this was a nationally representative survey, they asked Canadians if they were concerned about the challenges faced by Canada's long-term care system. 85% of those polled said they were. And that jumps to an absolutely eye-popping number of 97% of people 65 plus who said they are concerned about those challenges. Now, if you think about that for a moment, people who are 65 plus are, if you want to put it this way, key target audience people for looking at long-term care, looking at the possibility of long-term care. And 97% of that market says, no thanks. If this were a commercial poll, that business, whatever it is, would be out of business extremely quickly. The second poll I want to draw your attention to is a more recent one reported in July 2021, this time by the Angus Reid Foundation. Again, a nationally representative sample. One of the questions that they asked was all about tax. They asked Canadians, would you accept a tax increase to fund improvements in long-term care? And to everyone's surprise, 55% of that poll, those respondents said they would consider it, they would accept a tax. Now this from, as we all know, a notoriously tax-averse Canadian population. And the reality is, if this gets to a reality, people will still object and they'll be still back and forward on that. But if I were a policymaker, I would cheer at this number, because what it's telling me is that the door is open at least to consider some options here. People have recognized that this is a really serious issue for us all, and they are willing to see government money go behind that. The other finding from the Angus Reid Foundation, and this one is something that I think financial advisors would cheer at. From the same poll, they asked people what they would do, and 22% of the respondents said that they plan to start a savings plan to pay for health costs to avoid going into long-term care. Now, the interesting thing here, yes, it's still only 22%, but this is new money. These are people who have not, to date, even thought about this issue or thought about starting to hedge against the possibility that they might go into long-term care. And as a financial advisor, I know you're looking at that and saying, you know what? What it's showing is that there is a growing appetite for people to at least consider what might happen should they be faced with this situation and to make a plan accordingly. So it very much gives you an opening as a financial advisor. But taken together, it's a very depressing chart, quite honestly, because, and it highlights why it's so difficult for you. Because really, why would clients create financial plans to interact with a system that they don't want and which they hope to avoid? So if clients don't see themselves in the long-term care continuum, and I'm building up these charts again, where do they see themselves is in this allied pod, if you want to call it, and we've called it aging. And we'll expand on this as we go forward. It is overall allied to long-term care, but it is in fact psychologically quite separate. As you see, it overlaps. We've overlapped it slightly with home and community care because definitely there is some overlap there, largely because aging is taking place outside the long-term care institutional system. What is the aging pod all about? Karen used the word independence, and that's absolutely right. Seniors prize that. And I'm adding another word to this mix, which is autonomy, which is all about choice. People want to have the choice. They want to be in charge as they age, as all of us do as we live our lives. And amongst the things that encompasses this in terms of seniors and how they live their lives is that they want to choose where they want to live, how they want to live, with whom they want to live. They want to choose if they need help, depending on their situations. They want to choose what help they need. They want to choose what time the home care person comes in and so forth. Yes, they are interested in assistive devices, but they want them to fit into their lifestyle, not look like they have just been wholesale moved from the hospital. And there's a great appetite for tax assistance, tax help, some sort of financial assistance here. And to be fair, there already is some. There is something on a federal level. Each province has various things. They tend to be fair to come and go, and it is very difficult to keep tabs on what's what. But the importance of this pod is that that is where people see themselves. Now, Canadians are not naive. They're not saying do away with the long-term care continuum in any sense, but they are saying, I don't see myself there. I don't see my life here. I hope not to have to engage with this system. But if I do, I will, if I have more serious health issues, then clearly I need to know it's there and I need to keep that in my plan. So if we come back to our idea of, for me, how do your clients see themselves aging? And how does this impact how you talk to them? We want to find a place that is more positive to couch this discussion than negative. And here's another construct, or an alternative construct to all of this. When people say, for me, they see themselves aging in this kind of sense, which we've called the aging landscape. This is their life as they age. You can see it's quite a lot bigger than just long-term care. You can also see that long-term care fits very nicely into this as a risk I must manage. A safety net, if you like, something that is there if I really do need it, and something that I need to take account of. But I want to discuss that in terms of a much more positive overall landscape, the aging landscape. And why does that work? It works because it reflects not only what consumers want, but the consumer reality in terms of aging and healthcare. And that is that not everyone will go into the long-term care system, but everyone, as they age, will have out-of-pocket healthcare costs. And that out-of-pocket is a key driver and a key motivator for clients and a key opening for you to encourage them to create funds to defray some of those out-of-pocket healthcare costs. So what are the implications overall for the client conversations? And how do you get people to move from, I don't want to talk about this at all, to thinking that, yeah, this is for me. I at least want to consider it. The solution, if you like, is to reframe the context within which you have those client conversations. And one of the things that is going to help you quite a lot to be able to do that is the impact of the growing aging marketplace, which we will look at next. This is a big chart, and I don't want to spend a huge amount of time on each of these, but it's important to know, and it's important to acknowledge, that there are big societal forces changing not only your client's world, but everyone's world, and on a global basis, not just in Canada. Think of these as proof points, if you like, that you can bring up with your clients to say, yes, this is part of the rationale for looking ahead to your healthcare costs and to making sure that you have enough put aside for them. Things like demographics, as Karen mentioned, by 2030, 1 in 4 Canadians is going to be a senior. And remember, those seniors are going to be boomers. I'm a boomer. I know a lot of you on the call are boomers. Boomers are consumers, and boomers are demanding people. And boomers throughout their lives, throughout our lives, have changed our society as we've moved forward. So there's just going to be a lot more people demanding change, demanding services, demanding a better way. Financial services has been, I think, a real story through COVID, and particularly for people such as yourself who've seen that your senior clients, and that was the surprising cohort, I guess, your senior clients have very much taken to looking online and receiving information and client education and whatnot online. But I think financial services is an interesting thing in terms of financial advisors, because, and it's one thing that all of you have said, we want to help our clients through our life's transitions. Talking about life transitions, you're not going to leave that to a robo-advisor. That's where personal one-to-one, whether it's face-to-face or not, but one-to-one advice is really going to shine. So your advice is going to be at a premium to your clients. It's going to add value. So I think that's very good news for financial services. Healthcare, the big news really, or the big headline in terms of healthcare, is that home is going to be the healthcare setting of the future. And this is a global move. I mentioned I'm doing some work in the UK, and one of the pieces of work there is with the hospital system, who are looking much more at things like campuses of care. How do we move some of what we used to do in hospital to the home? There are lots of reasons you want to do this. It is more sustainable financially. Consumers want it. The medical community wants it. And interestingly, the medical community is finding that the health outcomes are much better if people do their recovery, for sake of argument, in their own home or in their own setting. Work has changed considerably over the pandemic, working from home, remote working, but equally, a lot of trends were in place well before COVID. 10 years ago, who would have heard of gig working? Who would have realized that freelance was, such a predominant employment segment? The implication for you in terms of your clients and how they do their retirement planning is something you already know, that sometimes that's not going to be anything like as linear as it was in the past. And some people, because of this gig working format, are not going to end up with the pension pots, retirement funds that they hoped for, and they'll need your advice. Housing is an area I'm working in all the time, and the big thing there really in terms of the aging marketplace is the new possibilities now of aging in place. I was just on a webinar earlier this morning, and they have some new figures to say that in the next 2 years, they reckon that people are going to be spending anywhere from $8,000 to $50,000 per household in fixing up their homes. And a lot of people have already started to do that so that they can live in their homes in terms of aging in place versus going into the long-term care system. And government. Karen mentioned political will. Is there going to be political will? Well, the fact is, there doesn't need to be so much political will if what you have is growing and significant consumer pressure and voter pressure as well. The government will have to make good on their promises to fix, if you like, the whole healthcare and the long-term care system. So these are background forces that are changing everyone's world and having an impact on your clients. In terms specifically of factors driving the aging marketplace, here are 6 further ones. Aging in place, we have already discussed. Wellness is a very interesting thing because wellness, when it started out being a term, it was all kind of new agey and crystal healing and whatnot. It's now very much moved into the corporate sector. One of the areas I've been working in is benefits and looking at how clients create benefits plans for their employees. Wellness has now taken on the mantle of, I as an employer are helping you as my employee to increase your wellness overall, not only physical wellness, but very much the topic of the moment, which is mental well-being, which has taken, again, a huge hit over COVID. In terms of factors driving the aging place, we need always to remember local options. Yes, healthcare is a provincial responsibility, but the fact is people don't live provincially. They live locally. They live in their town. They live on their street. They want services that are local. They want their friends to be local. They also, interestingly, are very happy to have their financial advisors local, or at least local enough so that those financial advisors know what is happening in the locality. And this, again, is a value add for you as financial advisors, I think. And it's something that a number of you told us, that you're very involved in your communities in various ways, not only in business, but just as individuals and as businesses. That is very much going to stand you in good stead, because the options that are local are the ones that people are looking for. Regulations, again, Karen posed the question, are regulations going to change? Well, interestingly, one of the big organizations in Canada, the Health Standards Organization, convened a committee just at the beginning of this summer and they are charged with coming up with recommendations to create national standards and regulations for long-term care. And agreed, some standards did exist before, and agreed that they weren't monitored. A number of provinces pre-COVID took the funding away from inspections and from monitoring, and that was one of the key reasons that long-term care homes took such a hit over COVID. That, and it's good news, looks like it is starting really to gear up and be properly organized and managed. Elder care is the new child care. Now, I mentioned this to Karen recently, and she just chuckled and she said, you know, that phrase has been around for a long time. And I don't disagree with her, but the importance is that it is now becoming a term in the public dialogue, in the wider public dialogue. It's not just in the aging community anymore. You see this phrase turning up in conferences, turning up in the media, and the importance of that means that it now has a profile as a topic, and people are going to be learning more about it, hearing more about it. It's going to be taken more seriously. And finally, we come to the pandemic, which has had multitude of impacts on our lives and on the aging marketplace. But to me, the most significant one, particularly again, if we are talking about you and making it easier for you as financial advisors to have discussions with your clients, is that through the pandemic, seniors care, how we treat seniors in this country, has become a media topic. And it was a niche media topic in the past, but now it is front and center. It's on traditional media, it's in social media. People are talking about it when they're able to get together, and that's not going to go away. And that added informational backdrop is going to be very useful for you as you discuss all of this with your clients. So where is this all going? You know, and there is a direction of change here, a direction of travel. And in shorthand, because this is a big chart, but in shorthand, what's happening here is that aging is moving from a system that is largely based on people being the recipient of care, so a patient, if you like, to people being a consumer of care, so a client. Now, you have clients as financial advisors, so you know what that means. You know what a client-centered model is all about. Clients are demanding. You've got to meet their needs. They can't just be given what you decide, or in this case, the healthcare system decides it should need. And this, again, is not just a Canadian direction of travel. This is a global phenomenon, really, and for all sorts of reasons. People, the medical community is finding that people much prefer, and the medical outcomes are much better if you can keep more people out of long-term care. So we're moving to a situation where there's going to be less custodial, which, as we see, people do not like, to more a sense of collaboration, where people are collaborating with their medical teams and their wider healthcare teams to keep themselves well. Instead of a bureaucratic continuum, which just has become hidebound, it's moving much more to a personalized roadmap. In the current system, people have to fit into the system. Now, Karen mentioned her lovely dad. Both of my parents, mercifully, both deceased now, but mercifully both escaped going into a long-term care facility. But for the last year of each of their lives, we had home care and lived to tell the tale, although I'm not sure my deceased parents would say the same. It was a nightmare until we figured out just how to navigate that. It was very much that the recipient, my mother, my father, had to fit into that system. What people want and where this is going, and what just works better as well for everyone, is that the system fits the client's needs and demands. Instead of a largely reactive situation at the moment, where unless you are defined as one of those illnesses that we saw in a previous chart, or tick the boxes in terms of activities of daily living, you don't get into the long-term care system, you don't get care, you don't get funding for that care. we're moving ahead to where, yes, there's a certain amount of reactivity still. I mean, after an accident, for sake of argument. But the system is moving to, because it has to and it needs to, a much more proactive stance, much more preventative medicine and ethos, and moving to wellness, as we said, because as people are living longer, many of them are also living better. Yes, they are aging, but there are a lot of healthy older people around, and wellness is very much what they want to be thinking about to keep themselves as healthy as they can for as long as they can. And basically, in part because it is financially unsustainable. Globally, healthcare markets are moving from largely a public health only situation to something that is much more public health and private pay. And that's an important thing in terms, again, of your pitch, if you like, to your clients, to say that, you know, yes, it is looking more positive and things are moving in the right direction in many ways, not in all, but in many ways. But one of the consequences is that a number of the things that you assume will be paid for either through government long-term care or in medical situations, you are going to have to pay for yourself now. And that is a really good argument for them to start creating a fund to help them when they get into the need of needing some healthcare assists. So we're moving from a long-term care label basically to an aging label. And when I said it's not everything is changing and it's not going to move that quickly, maybe, but the reality is purchase intent is already changing. Now, I don't have a chart with purchase figures for a number of these things, but purchase intent is a really good indicator of where consumer minds are going. Chip reverse mortgage, and I know some financial advisors told us that they don't recommend this, but the interesting thing is that consumers are looking at this as a potential solution. They want a solution to be able to stay in their own home and fund that somehow. Such is the interest that anecdotally, Chip Reverse Mortgage told us in a webinar back in October, I believe it was, that they had a 400% increase year on year in inquiries. And a lot of those inquiries were coming from the adult children of aging parents who had multi-million-dollar homes in large cities, but no income. The March of Dimes did a study this spring, and they turned their attention to aging in place because they found that a lot of the applications for their previously disabled only devices, wheelchairs, walkers, whatnot, were coming from seniors who were aging in place and starting to lose their mobility as opposed to being totally disabled. They did some polling as well. They asked people about had they done any home modification, home adaptation to date. 64% of the seniors that they talked to said that they had already taken some steps to modify their home to avoid going into long-term care. Now that could be anything, to be fair, from a relatively inexpensive grab bar to something much more expensive, in some cases installing elevators in their home or creating a new bedroom and bathroom suite on the ground floor. 64% of people said they had already done something, and a further 40% of those seniors polled said they plan to do something. Age Well, which is a Canadian organization that looks at how technology helps seniors as they age, they've done polling as well, and they found that 70% of the people that they spoke to said that they were happy to self-pay for monitoring and other assists to allow them to remain independent in their home. So this is evidence that not only are people seeing that government is not going to pay for everything or maybe already deficient in what they are or not paying for, but people are willing to spend their own money to give themselves a better life and to age the way they want it. And interestingly too, consumer brands are increasingly meeting this demand. And I've highlighted for here, I could have done 25 charts with just off the top of my head brands that are targeting the seniors market in one way or another. And why? Not because they have a ethos of seniors, particularly because they see a demand and they see that people are willing to pay. Some of them I've highlighted here, IKEA, which is looking at all of its designs and saying, not only do they fit for older people, but do they fit for anyone with any degree of mobility? Moen, which is a very high-end and very expensive company that does home electronics and home appliances, including things for bathrooms, very spa-like bathrooms. They have a marketing stream for seniors aging well. Philips Lifeline, which I'm sure many of you have heard of, they do medical alert systems, and they talk about maintaining an independent lifestyle with support, 24/7 access. And a fairly new retail concept in Canada, Wellwise from Shoppers Drug Mart, is mainly in Ontario at the moment in their stores, but with plans to roll that out across the country. I love the way they talk about what they are doing. They are saying that this retail concept is created for Canadians who want to take charge of the way they age. And apart from showing you that there are companies starting to meet this demand, I also want to just highlight how they're speaking about this, because equally it can give you some lessons as to how you speak to your clients. The terminology, the tone, the words they use are all very positive, very empowering, very you take charge, very aging well, very living independently. None of them are getting into that negative territory that very often discussions about long-term care get into. After we've looked at all of those things, let's see how we can pull all of this together. How can we return to our goal in this presentation, which is to help you make your client conversations easier, both for you and for your clients? And one important thing to just keep in mind throughout this is, what is the overall goal we're trying to achieve? We're trying to ensure that people in good time make plans for how they're going to spend their retirement, and within that, any risks that they might have in terms of healthcare. So basically, you as the financial advisor, you are helping your clients make a plan before they actually need to activate that plan. So let's see where we go with this. If you remember, we have said that the way people see aging is a much broader landscape than only long-term care, but that long-term care is a very important element in that it is a risk that they must manage. And the benefit of looking at it in this way for you as an advisor is that you've got increased opportunities for easier client conversations, and for client conversations that can happen well in advance of people needing that. I was struck with something Karen said, that one of her case studies, a woman came to her at 57 years of age, which Karen said was unusually young for someone dealing with this. Well, you know, ideally, looking at it in a broader way of aging, one might start being able to have those conversations at a much younger age, and therefore longer term. And longer term also for their benefits to just be better for them. We've seen that positioning long-term care within aging makes those client conversations easier, because what you're doing is reframing the context. You're not changing all the things you're saying, but you're reframing the wider context about planning for healthcare needs as people age. So I'm going to finish off my presentation with taking us through and working through some examples, but let me just start with this 6 kind of tips really before I get into those examples to keep in mind. We've spoken about the importance of starting early, and it has a number of benefits. As I said, it enables you to start planning well ahead of, say, a catastrophic situation that people, you know, find themselves in very often. But the other thing, starting early, almost by definition, means that you start with people that are probably in better health, maybe in a stronger financial position, and so on. It takes a lot of the really difficult emotions out of things if you can start while people can still be pragmatic about their decisions. all of you told me when I interviewed the financial advisors that I did that you cite the discussions about long-term care within discussions about retirement, and that is absolutely logical and you know, the right place to be. And it gives you the opportunity then to put quite a positive spin on it, albeit acknowledging the risk. Leading with successful retirement allows you to put a very positive context in terms of discussions you're going to be having about not only retirement, but about aging within that and about the risks of healthcare implications within that. The next three, I'm going to take all together. So highlighting the choices and the options that your clients may have, creating case study outcomes, and developing a ballpark cost formula. Basically, what we're saying here is that no way do you need to be as literate about long-term care or aging as, say, someone like Karen is. But very often what you told us was that the conversations about long-term care come to something of a halt because nobody knows what the facts are and where to start that conversation. Having even a limited number or an outline of what choices and options are available to people, what other people have done, so case study outcomes and did it work, did it not, what lessons learned, and some idea of ballpark costs. What generally might it cost people to start making a plan to look at the potential healthcare costs? And going back to our idea that we're talking about aging, not only long-term care, and going back to the idea that, as we've seen, the aging marketplace is booming and only going to be getting stronger, those costs should also take account things that are not within, say, the long-term care continuum, particularly things to do with aging in place, which is very much a mainstream line of consumer thinking now when they think about aging. And the last point here, and this is the point that's going to take us into our examples, is you already are segmenting your audience, your client base, but it's important to segment by life stage, not by age. People are continually saying now, you know, age is only a number, and to a very large extent that is true. Not every 50-year-old or 60-year-old or 70-year-old is like the other 50, 60, 70-year-olds. So what are they like as people? The way that we're going to do this is to look at just 4 potential segments within your client base. Now, I've only picked 4 for today for illustration purposes. Depending on what your clients are like, who they are, they might be very different examples. Equally, some of your clients could fit into more than one box. But for purposes of illustration today, I'm going to pick these 4. And how I have chosen them is that these people are in a life stage, not just a specific age. So 21st century workers. We've mentioned already that work has changed significantly over the last several decades, quite honestly. The implication is that people like entrepreneurs, gig workers, freelancers, people that might retire early or people that might never retire at all and want to keep working well past retirement age, the pattern via which they accumulate their retirement fund might be not as conventional as was the case before. And for some people, they might have taken time out, or they might have invested in a business, or some reason why maybe their retirement fund is not as healthy as they would like it to be. Classically, you're looking at a young demographic, but not any longer. And as we've seen with COVID, it gives people who are quite senior, in fact, the opportunity now to keep working, to work remotely, to work part-time, and so on. Caregivers are generally in a difficult situation in terms of caregiving has very often been thrust upon them without a whole lot of pre-planning, as opposed to being something planned. And very often those caregivers are family members. Very often they are ill-equipped financially and otherwise emotionally to deal with the implications of their becoming a caregiver. there was a poll, a Ledger poll in 2019, and I think this was quite a disturbing finding, that some younger workers in that poll said that they could see themselves going forward delaying their own retirement to fund the care of their elderly parents, which is pretty frightening, but also says caregivers are people who need advice. Asset decumulation is a much happier situation, but it is a very present situation. And as people are getting near and at retirement, there are loads of people who have built up decent retirement funds, but now the challenge is, how do they start drawing from that? Back to something we mentioned earlier, they don't want to make a mistake with this. And this is something where, again, they need the advice of financial advisors. And the last example we're using today is people who are single in their senior years. And just in terms of finances, sometimes it means that various tax implications, various ways of accessing their retirement funds are not open to them, income splitting and whatnot like that. But equally, senior singles might not have the support system that maybe people with larger networks, larger families have. Not always, not in every case, but it is something to look at and some way that you as their financial advisor can help. So to bring this to life a little bit, I've given each one of these a persona so that we can figure out how one might start to craft an entry point into a client conversation. So an example of our 21st century, and she's a relatively young one, Carrie, who's 50 years of age. And Carrie has realized her lifelong ambition to open an artisanal bakery, which is going very well now. But while she was setting that up and she quit her former job, all of her money was going back into the business. So Carrie is missing a good number of years of income. And her worry now is, have I saved enough? David, at 62 years of age, had caregiving thrust upon him, interestingly, twice, once with his father and now with his very demanding mother, who doesn't want to have any outside help. So basically, David is carrying all that care for his mother. And now what's happening is his own health is suffering. And as many caregivers have found, they have not made provision. A much happier situation, as I said, asset accumulation. And Amina has been a saver all her life, has built up a nice retirement fund, but she really has no idea how to start drawing down. And she's worried about doing the wrong thing and maybe running out of money. And Keith, who at 66 is our example of a senior single, he knows that there are some things that he can't do in terms of finance, but equally, he needs some advice as to how to just go forward in his life generally in terms of things like his accommodation and whatnot, building up his network. So how does what we have already talked about earlier in this presentation, and how does knowing something about all of these people as individuals help us create a client conversation going forward? Let's start with Carrie, our artisanal baker. And as I said, lower lifetime earnings are a bit of a worry to her, and she's not sure she'll be able to retire when and as she wants. With each of these client conversations, there's both a life stage situation, potential motivator. There's also a barrier to that. And that's important to look at as well in terms of crafting the conversation. In terms of Carrie, it's the fact that she's still quite a ways off retirement. So the barrier here might be that her concentration is still on wealth creation versus protection. But the fact is with Carrie, she's an entrepreneur, she's a business owner, she has employees, people are relying on her. And what happens if that comes to grief? So creating a care plan, which as she is still working, you're the advisors, you decide, but possibility, it could start with critical illness cover and move forward. But somehow Carrie would benefit from a hedge against the risk of illness or injury. So how might you start to introduce this idea within retirement planning? Well, you might say to Carrie, you know, Carrie, it's never too early to begin planning and setting aside funds for retirement and to guard against the risk of healthcare costs as you age. Plus, if you start now, it could mean that you could retire early if you choose, or even when you choose. And the other thing, Carrie, is you are an entrepreneur, you are a business owner, you do have employees. How would your career and your earnings and your bakery be affected if you had to become a carer for somebody you love? Can you make a plan to protect both them and you? So what's happening here? One, we're starting in a very positive way with Carrie's successful business and acknowledging that, and acknowledging that she still has time to build up funds, to plan ahead. But it also says that, you know, you're in a little bit of a precarious situation should something happen to you, either with yourself or maybe with somebody that you need to end up caring for. So let's make some provision here. The other thing is, one of the things you want to do as a financial advisor is grow your business. And we had a lot of discussions when doing the interviews about, can we bring on other people in the family, building legacy businesses and whatnot like that. That's sometimes, you never want to go out and sort of tout for business, and people don't like that. But saying, you know what we can do can also include other people in your life. It is a very easy, organic way of widening your circle, and in a way that actually helps your client, adds value to what you are doing for your client, as opposed to doing a hard sell. The next example we have is David, who is the carer and who has not made any provision. David's big motivation is clearly caring for his mother. He almost is not caring for himself as much because he's worried about him as much as anything else, in terms of who will take care of my mother if something happens to me. And as I say, a lot of caregivers just have not made provision, and that's the real barrier here, is where does he start? So how might you approach David? Well, David, you know, we want both you and your mother to age as well as possible. So let's look at setting some funds aside to cover the costs of care needs. First of all, for you, David, as the carer. And also, there are probably some allowances out there that you're not taking advantage of that you're probably entitled to. And also some respite services that are there within your community that might be able to give you a break so that you don't become overwhelmed. And at the same time, let's review your mother's situation to see if we can better fund her care needs or take advantage of anything that might help that, and ultimately manage the risk for both of you, for both you and for your mother. And again, what is this doing? It is saying, you know, David, we want not only you, but your mother to be well. It's absolutely tapping into David's long-term motivation. But as we can see here, and with David's demanding mother, they are avoiding going into the classic long-term care continuum, but they still have costs, healthcare costs that they need to cover. And equally, there are still advantages out there that they probably aren't even accessing in services. Amina, as I said, is a much happier situation. She's got a nice retirement fund that she has built up. But as a lot of Canadians are, she doesn't know what to do now. And interestingly, this is becoming, in fact, it is, it's not becoming, it is a key issue for people like benefits planners. And Benefits Canada did a poll this year of their plan members. And so these are people who are at or near retirement, they asked, and they found that 40% of those people that they asked had a poor or no understanding of how to start drawing an income stream from their retirement funds. Now, people like the benefits plan, people are putting in place programs within the employee schemes that are going to start educating their plan members about this. But this is a characteristic of a lot of people within Canada. Again, something that financial advisors can very much help with. So how do you start a conversation with Amina to take those things into account? And you might look at it in terms of, you know, she is 64. You might take a look at, is she in good health or is she not in good health, and tailor your conversation appropriately. So let's say she's in good health, and you might say to her, you know, Amina, Now, with your good, strong retirement fund, you get to reap the rewards of your planning. But even within that, we need to proceed wisely to maximize the value of the savings that you have accumulated and also to mitigate against any risks. If she's not in good health, you might actually get more directly into what you're going to do about those risks. So let's look at how we can structure your retirement income to assure that we have the best choices for you, such as maybe modifying your home to make it easier for you to live there if that's what you want to do, or possibly moving somewhere with no care, with more care, and possibly long-term care. And that's where you can start getting into then some of the choices and some of the detail that Karen laid out earlier in this presentation. Last example is Keith, our 66-year-old senior. And as I said, he's concerned about how he structures his retirement going forward in financial terms, but also interestingly in non-financial terms, in the non-financial aspects of his retirement. And this again fits very much into the sort of mindset that I saw coming out of financial advisors. A number of you mentioned it's not just about the money. One person said, you know, we want to have our clients think of us as people that help them through life's transitions, both on the financial side, but also generally in a wider sense. And this is exactly the sort of tack you can take with someone like Keith. You might say to him, you know, Keith, how do you want to take charge of your retirement? Do you want to stay in your current home or do you want to downsize? Whatever you decide, we can introduce you to a number of people who can give you advice. And we can also structure your income to make sure you can live the way you want and to get whatever help you need in the years ahead. So what are you doing here? What are you drawing on? Not only your financial expertise, but also very importantly, your network. And this again is one of the examples of where a local network of other experts. So you might introduce Keith to an occupational therapist who might come in and take a look at his house and say, you know what, we could possibly make this change or that change or another change. So all the time it is adding value, it is starting with positives and leading through to the eventuality and the possibility of risk as one goes forward. So with all of these examples, and as I said, you can segment your audience in so many ways, but look at it as a kind of a formula, as a template in the way that you craft these examples for your clients. And let me just leave you with 3 conversation building tools. Now, these are tools you already have, and I don't know whether you've thought of them as conversation building, but when I spoke to you, I was struck with all 3 of these, and I think they're very, very strong. And I think that maybe they can be used maybe even much more in terms of helping you have conversations with your clients. The first one is Know Your Client, KYC, which is the bedrock of everything you do. Obviously, you're collecting information, administrative and financial, and their financial goals and whatnot. But is there an opportunity maybe to increase the information that you're getting? One of the great things that you have, to me, why it's golden, is knowing your client is the absolute gold standard of marketing. And big companies spend millions and millions and billions of dollars trying to find out about their client, trying to know your client in a way that you have total direct access to. And the great thing is your clients are willing to tell you a lot because they are telling you in the confidence of your relationship with them, and also in a way that they can see is being asked for a reason and is adding value, not just a situation where they are being sold to. It might be that what you want here is to look at building some sort of a template so that you can capture that information, and you can capture it in a number of ways. But it is very, very valuable, and I think maybe even more valuable than you realize. The second one is case studies from your own clients. What everyone wants to know when they are building a plan for their retirement, for anything else really, is, what have other people done? Has it worked? Has it not? What lessons can we learn? You have the advantage in your client base to have people who have already gone through these situations. And a number of you mentioned this, that one of the ways that you help your client build a plan is that you look back and see what others have done. Being able to turn these into more extensive case studies, obviously anonymized, and taking the actual identities away, would be very helpful, I think. And maybe, again, this is something that you can make more of, create them in a storytelling type of way that illustrate to your clients the options, the outcomes, the pros, the cons, and how you can help them. And the last one is all about fintech. And a number of you discussed when we were talking about, when we were doing the interviews, that you have upgraded your planning software in the last few years. And some of it is amazingly sophisticated and an incredible way for you to, as you describe it, run the numbers. But one of the things that we found when we're talking to actual clients, and this is not only in terms of long-term care, but I've done a bit of work with banking clients in terms of how they present solutions to their own clients. And very often people don't understand the illustrations because they are financial, they're just numbers, they are numbers on a chart without really any context. One of the ways that you can use planning software is either individually for clients or in a wider sense in terms of client education, to look at things like what if scenarios, to look and say, if you do this, this might happen. If you do that, that might happen. And to start explaining how you get to the numbers you get to. So with that, and in conclusion, what have we seen through this? We've seen that long-term care is a very difficult thing to sell straight out. And how do we know that? Well, you told us right from the start. But positioning long-term care within a wider landscape of aging not only appeals to your client base much better, but makes conversations easier on both sides. And how are you doing that? You're doing that by reframing the context for those client conversations so that they can talk to you much more easily, less emotionally about planning for their healthcare needs as they age.
All right. Thanks very much to Karen and Margaret. Excellent presentation and lots of great questions. Thanks to everyone who submitted questions to the Q&A and the chat. We had so much content, it was difficult. So we just have a few minutes at the end for a few questions. And if we don't get to your question, just make sure to send us an email, ce@advocis.ca. And I'll also put Karen and Margaret's contact information in the chat as well. And we'll have resources. Margaret had some resources at the end that we cut off the video, but we'll put those as well in the follow-up email to you. And we have Karen's resources as well in the follow-up email that we'll send to you. A couple really good ones we had come in. Karen, is there anywhere where we can see the wait times in different provinces across Canada? Oh, Karen, you're still on mute. Sorry.
Mea culpa. Yes, I know certainly you can in Ontario. If you go into the Government of Ontario Health and Long-Term Care website, with respect to the other provinces, I don't know. What I would suggest if somebody wants to do this is to Google wait times for long-term care in Saskatoon. And that should take them to, if there is a spot where that information is available.
Perfect. That's great. And there was a question I thought that was really good as well. If you are proposing long-term care insurance to a client and they have the objection, well, you know, what if I never use it? I could have put all that money, you know, elsewhere. How would you kind of handle that objection.
Yeah, that's one of the biggest ones. What if I never use it? And I guess the answer is, but what if you use it? And because we're living longer, and because we are now living in a more uncertain world, I think those are the two reasons that people have come to me and said, Karen, what about long-term care insurance, including advisors? And there's no real right answer to that question. I think that if I were looking at that now, I would purchase the product, but I would not. I mean, you can purchase return of premium, which will then, guarantee that all the money that you've put into the product will be returned to the beneficiaries. But of course, that ups your premiums considerably. So I think you've got to look at your situation and your family history, your present personal medical history, what you're coping with, what your longevity looks like using the tools that I presented, and just come to a decision. What is the best for me?
Perfect.
Could I just add to that? And it's an answer that I think came out of some of the interviews we did with financial advisors. Remember what we're not proposing here, although all the questions are about the products of long-term care insurance. But the key thing here is to make a plan. And it's, this is where you use the expertise of the financial advisors to come up with this. One of the things that a number have said, and I've heard some actual clients say this as well, is that they just set aside in whatever instruments a sum of money, and that sum of money is allocated to healthcare costs. And one person told me that they did that years ago, never used it until they had a cancer diagnosis and then needed it. So I think there are a whole lot of options. And this, again, as I say, is the expertise of the financial advisors to look at all of those.
Yeah, that's great. Thank you. Exactly. And I had a really great, there was a great question from an anonymous attendee that I thought would be a really nice way to kind of finish it off with, for both of you, long-term care of the future, aging of the future. What are your thoughts on how technology can help us? How can we make it better? Any way that we can propose long-term care being fun?
Margaret, do you want to head off on that?
Yeah, sure. I'll start with that, Karen. I'm not sure, to be fair, that long-term care at its, at the really tough end of things is ever going to be fun. Karen's been through this with her father. I've been through it with my parents. It is not fun. The fun part is successful aging and being as healthy and as productive as you can pre that. And I think what's going to make it, if not more fun, at least more doable and more palatable, is simply that the marketplace to help people age better is growing. And that is one of the consequences of COVID, that not that it started that happening, but that it fast forwarded that happening. The other thing, if I could suggest, and we didn't really mention it in this presentation, but I would certainly encourage financial advisors to get their clients to look at the really strong advocacy groups that are now just have an extra zip in their work. One is CARP. The other one is CanAge, which is the advocacy group that is doing really wonderful things and being asked to get involved in things like the regulatory environment and whatnot like that. Those are things we should support, because those are the type of people that are going to change policy as well as change the marketplace. So yeah, keep positive, please, but plan.
I agree with Margaret that what we have lived through was not fun. However, Margaret mentioned AgeWell, which is a very prominent international company based here in Toronto. And the research that they are doing into things like robots and the smart house, where a person with Alzheimer's can go into the bathroom and is cued to wash their hands and dry their hands and do this, all kinds of things, which helps them remain as independent as possible and takes burden off the family. So I think technology is going to be a huge driver for improved long-term care. There's no question that it is, billions are being spent on it. And it's just a matter of getting the researched products to market as quickly as possible. So yes, be optimistic, advocate, belong to whatever groups you believe in. There's the National Health Coalition, which has chapters in every province. I support the Ontario Health Coalition. These people are really pushing for change. It's got to be pushed from the grassroots, because we know it's not going to come from the politicians, because they don't have any political will. So there's lots to look forward to. There's work to do. There's education of your clients. There's lots of tools. And, it's in your hands. You have a tremendous opportunity as advisors. It's in your hands. And I ask you to seize the moment.
That's great. That's a great way, I think, to end it off. Thank you so much to everyone who joined us. Thank you so much to Kren and Margaret for your excellent information that you've provided us today. We will be sending you a follow-up email with the links to the resources that Margaret and Kren provided, and also one of the great resources from Kren on client conversations. And also, of course, you can go to their websites for more information as well. Reach out to them directly. We'll give you we provided their contact information in the chat, but also reach out to ce@advocis.ca if you need anything else, and if you have any other further questions. And thank you again, everyone. Have a great rest of your day.
Thanks, everyone.
Thank you. Bye-bye.
Bye-bye.